Hi, I'm Stephanie Valencia,
And I'm Cole Gleason.
and we will present our work, Disability and the COVID-19 Pandemic, using Twitter to understand accessibility during rapid societal transition. The COVID-19 pandemic we have been living through over the past 7 months has upended our lives and reordered priorities for everyone. As the initial stay-at-home orders spread throughout the US in March, we heard many stories of people with disabilities being affected by the changes that people and institutions undertook. We set out to document the ways that this rapid change affected access to services and information.
To capture this, we looked at Twitter, a public social network that often reflects in the moment reactions to current events. Prior research has documented how people turned to social networks during crises like the Deepwater Horizon oil spill or Hurricane Sandy, finding that people used sites like Twitter to find, verify, and share local information. This has also been documented as an information source for people with disabilities as well.
We started by collecting a large sample of tweets in the English language from April 6th to the 12th. This was a broad search of keywords, somewhat centered on hashtags like hashtag disabilityc19 and hashtag high-risk COVID-19, but also phrases such as accessibility and disability. At this time, there were around 30,000 COVID-19 cases in the US, around 5,000 cases in the UK, about 1,000 in Canada, and around 100 in Australia. We dug into the sample of tweets, coding the topics that people were discussing at the intersection of the pandemic and disability into broad categories. After reviewing the most discussed topics, we decided the ones we could best analyze and capture were grocery and product delivery, online education, and public health messaging. Other topics either did not appear in our sample due to low amount of discussion on Twitter, not strongly connected to our search keywords, or we avoided due to them falling outside the technology domain. To focus in on these three domains, we ran additional searches for keywords and hashtags related to these topics over the week from April 16 to the 22nd. Both of these samples reflect the height of stay-at-home orders put in place in the US, as the earliest relaxations came on later on May 1st. Note that the issuance and enforcement of these orders varied widely by state or city, as did the threat of the pandemic.
We will summarize our findings here, but please refer to the paper for methodology details and a full account of our findings. When social distance measures went into place, there was a significant shift to delivery methods instead of in-store shopping. Tweets revealed four important themes. First, people were coming together to provide mutual aid and support each other in finding scarce goods or picking up and delivering items. Second, there was an increase in delivery usage among everyone, leading to issues where people with disabilities who relied on those services before the pandemic getting crowded out and weren't able to get the delivery slots or the goods that they needed. Third, we observed that people were turning to Twitter to seek help, either in finding things that they were otherwise unable to locate or to ask for monetary support as they were hurting during the pandemic. Finally, people were using Twitter to advocate for delivery services, stores like supermarkets, and governments to do more to ensure that people with disabilities or who are high risk for COVID could get the products they needed. This included both praise and critique of specialized shopping hours, depending on how these were implemented at different stores. You can see a more detailed breakdown by supermarket chain in our paper.
The transition to online education often left accessibility accommodations and individual education plans behind. We found advocacy-related tweets urging parents and students to assert their continued right to education and urging legislators to not approve any waivers that would excuse educators from ensuring at-home instruction for disabled students. A high percentage of tweets shared resources on how to make online content accessible, such as making course content easy to parse, adding alt text to images, and generating captions for videos automatically using specific automated tools or manually. Tweets critiquing institutions' unpreparedness to provide accessible remote instruction highlighted the need for a shift from a need-based accommodation model to a universal design approach. Also, mentions of accommodation requirements being ignored before the pandemic made it notorious how people with disabilities have long advocated for remote attendance options for events and lessons, but only now are remote options openly and broadly available.
Access to up-to-date public health information is critical in a pandemic. People look to scientists and other leaders to understand how to avoid the virus and what interventions like closures were happening. Much of this information was not accessible to everyone. Take this famous flatten the curve graph, for example. It became both a symbol and a slogan for how social distancing can slow the spread, but the visual metaphor was typically shared without an alternative representation for people who were blind. That is until Naomi Rosenberg created a tactile version. We note that the CDC did not provide alt text for this tweet, nor any of their tweets for that matter. In fact, only 12 out of 50 state health departments ever did. An analysis shared several times in our dataset came from the markup, which showed that the coronavirus sites launched by states were largely inaccessible, with only 2 being free of accessibility bugs. People also discussed sign language interpreters at daily COVID briefings. In areas where interpreters were common on briefings, many news articles featured them. But in both the US and the UK, there was criticism at the fact that the national briefings from the US President and UK Prime Minister did not have sign language interpretation.
Overall, we found that the problems across these domains fall into 4 categories. First, existing accessibility problems were magnified by the pandemic, such as a lack of funds to support basic needs and having inaccessible educational and public health content. Sometimes we already had accessibility solutions, but they didn't have emergency backup plans, similar to prior work showing a lack of emergency preparedness efforts for people with disabilities in natural disasters.
On the other hand, sometimes emergency measures were rolled out without thinking about disability. For example, ad hoc signs and markers to reroute traffic flow within a supermarket, they were often not accessible to someone with a vision impairment. Alternatively, as online education moved on to video platforms for instruction, they were largely inaccessible to many people who needed them. And sometimes we saw small improvements to accessibility due to these changes. For example, accommodations that were previously denied to students to learn remotely were now allowed for everyone. But we need to make sure that these accommodations are kept in place after the pandemic is over.
We would like to thank all of our amazing co-authors and colleagues who helped make this work possible.
Thank you for watching. You can contact us by email or on Twitter, and the paper is available at bit.ly/disability-covid-on-Twitter.